Thank you all for coming. We're going to be going over sciatica tonight, and not just sciatica, but also other disc issues you can have in your other areas of your spine, your cervical spine, your thoracic spine. So, I'm guessing by your interest here that most of you have probably experienced sciatica at some point or another in your life, or any kind of nerve type pain, pinched nerves or anything like that. I had sciatic type pain when I was pregnant for a very short time. It's not fun. Alright, so what or where is the sciatic nerve? The sciatic nerve is the largest single nerve in the human body, and it's pronounced sciatic, not sciatic, just FYI. A lot of people say it's sciatic. Anyways, it runs from each side of the lower spine through deep in the buttock into the back of the thigh and all the way down to the foot. The sciatic nerve is formed from the L4 to S3 segments, so that's from your lumbar spine into your sacrum of the sacral plexus, a collection of nerve fibers that emerge from the sacral part of the spinal cord. The fibers unite to form a single nerve in front of the piriformis muscle. So, if you look at the spine, all that means is the sciatic nerve is formed from the nerve roots that join together to form the sacral plexus, and then when it exits through here, it's called the sciatic nerve at that point. But if you look at the origin, it comes from, it says L4 to S3. So you take L4 to S3 nerves and combine them, put it all together, that makes up the sciatic nerve. Alright. So actually sciatica or sciatic nerve pain is not a diagnosis in itself. So if you have sciatic pain, that doesn't tell me or tell anybody what's going on or what's causing that pain. So a lot of times patients will come in and they'll say, I have sciatica, can you help me with that? Well, that depends. What's causing your sciatica? Sciatica is just a symptom, and it's described as pain going down from the low back to the back of the leg. It can involve the sciatic nerve or the lumbar nerve roots. The lumbar nerve roots are here. So the nerve roots that come directly off of the spinal cord, those are the lumbar nerve roots. So when you have the sciatic type pain, you don't know exactly what's causing it. It could be a number of different things. So these are the things we're going to be going over tonight. These are the different types of things that can cause a sciatic type pain. Herniated disc is the most common, so we'll heavily cover herniated discs. Piriformis syndrome. Piriformis is the muscle that goes through here. Lumbar osteoarthritis, so that is going to be arthritis of the spine. Spondylolisthesis, pregnancy, pelvic lesion or tumor, lumbar spinal stenosis, or sacroiliac joint dysfunction. So we'll go over those more in detail. So to begin, a little anatomy. The intervertebral disc, those are, let me turn the slide back now. The intervertebral discs are in between your vertebral bodies. So those are the little guys sitting through there. To break it down even further, the innermost portion, you can see, so you can see where it says NP, that's called the nucleus pulposus. That is a gelatinous structure. Its main constituents are proteoglycan, collagen, and water. The annulus fibrosus, so that's going to be the blue on the outside. It kind of looks like a donut. The outermost portion, that's called the annulus fibrosus, is made up of these concentric layers, and each layer has coarse and strong collagen type 1 fiber bundles, as in tendon. So the material that makes up tendons. In a healthy intervertebral disc, the annular fibrosis contains about 65 to 70% water. And we'll learn on, as we go through the presentation, that A healthy disc is a hydrated disc. You want good hydration in your disc. The CEP, that's called the cartilaginous end plate, you can see the picture at the top. There's the little yellow strips on the top and the bottom. It's kind of like the bread that holds the sandwich together. That's called the cartilaginous end plate. It's a layer of hyaline-like cartilage that separates the disc from the adjacent vertebral end plate and consists largely of type 2 collagen, proteoglycans, and water. So again, even more water in that layer as well. So, a herniated disc. I'm sure most of you have heard that term. It could be called a herniated disc, a slip disc, a pinched nerve, or a bulging disc. It kind of is separated into 3 different categories, and these can only be diagnosed with like an MRI. You can see visually, what's going on. So herniated disc is where the disc has basically bulged or almost like popped. In a protrusion, the picture is here, you can see that the little blue part is just bulging a little bit, and that disc material basically just stays within that disc. So you can have almost like a little bulge. In extrusion, the herniated disc material migrates upwards or downwards, but still within the annular fibrosis. In a sequestration, a herniated disc, so this is where the fragment, the disc, bursts, and like the jelly-filled donut basically migrates upward or downward away from the disc. So you can have a herniated disc here, and if it's sequestered, then it's going to basically pop, and that disc material can go elsewhere in the body. All right, so how does this happen? How do we have herniated disc? First of all, it has been shown that it's not a normal part of aging. And I like to think of this as taking care of your teeth as you grow up. If you went into your dentist and had a cavity, they wouldn't tell you, oh, this is just a normal part of aging. Your teeth are just going to fall out of your head. You're hopeless. And that's kind of the same concept with spinal health. Some medical doctors and some professionals, once you have any sort of signs of degeneration, you can't necessarily reverse it, so I'm not going to say that, but you can stop it, and you can, up to a certain degree, prevent it. So it's not this normal part of aging that we're all just kind of stuck with at the end of our lives. There are things we can do to, try and prevent the degeneration from happening. So, disc degeneration the changes start with a loss of disc hydration. So I mentioned the importance of having nice hydrated discs, which are caused by poor lifestyle choices for posture, lack of movement to pump fluids into the disc. So we'll go over how the discs are nourished and what parts of the body we use to nourish our discs and keep them healthy. Loss of lateral spinal curves. If you're a patient here, I'm sure you know at least a little bit about the spinal curves and the importance of the good cervical curve. So we'll go into that a little bit more as well. And then there does seem to be a genetic factor. So just because your family members have it doesn't mean you're always going to have it, but you can definitely take things and prepare and try and avoid it. So this is a good visual of a healthy disc and then a degenerated disc. So on x-ray, if I'm looking at the spine from the side view on x-ray, I can ultimately tell if you have any sort of disc issues. Sometimes I need an MRI, but sometimes I can tell based on x-ray, because if you look at the healthy disc, what do you notice from the top of one vertebrae, or the bottom of this one to the top of this one? What do you notice? Space, exactly. So if I take an x-ray and I see this, is there any way this disc is healthy and hydrated and plump? Not usually. So on x-ray, we're looking at, is there good disc spacing? So a lot of times I go over x-rays with patients and I'll point out, look, you have great disc spacing here. But here, there's a little bit of a narrowing of the disc space. And that's what I'm talking about. Because in order for a disc to be nice and healthy and hydrated, there's got to be that good space in there. And then it goes on to show, here's the degenerated disc. So, keep in mind, I don't know if you guys know, but when I say degenerative disc disease, intervertebral osteochondrosis, osteoarthritis. These all mean the same thing. And it gets a little bit confusing because there's several words for the same condition. And this is sometimes shortened to IBOC. So all of these things basically means arthritis of your spine. And it's not like rheumatoid arthritis, it's like bony arthritis of the spine. So, looking at this x-ray, which do you think is a healthy cervical curve? Everybody know? That's actually not it. So, you guys guessed it. This is the good C-shaped curve that we want to see. Here are the disc spacing here. If you have a reversal, is it possible to have good disc spacing? Not really. It's not really possible in that reverse state to have good disc spacing. All right. So normal cervical lordotic curve, when it's in a C shape like that, in your lumbar spine and your cervical spine, those are called lordotic curves. And then when it goes into a backwards curve, it's called a reversal or a cervical kyphosis. Any kind of kyphosis in the cervical spine is not normal. All right. So, it's going to get a little bit complicated for just a minute. So this is a study that explains how a loss of cervical curve contributes to degeneration in the cervical spine or even the lumbar spine. The lumbar spine is the same concept. You want that good C-shaped curve. We're talking about sciatica. The lumbar disc herniation causes that sciatic type pain. So, here's the normal here. That's what we want. Here's variations of the normal. So you have a complete reversal here, or you can have an S shape, where you can have a C-shaped curve here, and then a reversal there, or the opposite. So this study looked at the different magnitudes of pressure in the normal versus abnormal cervical spines. So the top explains the axial and flexural stresses at each anterior and posterior. So anterior means front, posterior means back. So the stresses at the front and the back of normal were calculated. And here it is. Combined stresses at the anterior vertebral margins and the lordotic configurations were quite uniform. So you have that C-shaped curve. The stresses are distributed uniformly throughout the cervical curve. And the same thing with the lumbar spine. So then you look at, well, what happens in the spine when we have these abnormal curves? What kind of abnormal tensions or stresses go on? So combined stresses at the anterior vertebral margins in the kyphotic cervical configuration, so this one, the one that's gone into a kyphosis, were roughly 10 times higher in magnitude and absolute value than anterior tension stresses in a normal lordosis. So you take the normal curve versus the kyphotic curve, and you're placing on the front here 10 times the stress that a normal curve would have. And then it goes on to say anterior stresses in the S-shaped cervical configuration reached were 3 to 13 times the magnitude of a normal cervical lordosis. So this one, the front has 10 times the stress, and in either one of these, there's 3 to 13 times the stress in the front of the spine. So as you can guess, it's not good for you to have that abnormal stress. So it goes on to say, and it's explained by Wolff's Law. So how do I get from normal curve to abnormal curve to now I have disc degeneration? And it's explained by Wolff's Law. So Wolff's Law was developed by a German anatomist and surgeon, Julius Wolff, in the 19th century. The law states that bone in a healthy person or animal will adapt to the loads under which it's placed. If loading on a particular bone increases, the bone will remodel itself over time to become stronger to resist that sort of loading. The internal architecture of the trabeculae undergoes adaptive changes, followed by secondary changes to the external cortical portion of the bone, perhaps becoming thicker as a result. So in short, bone is added where it's needed and it's resorbed where it's not needed. So this explains how abnormal stresses on the front of the vertebrae can lead to degeneration. We'll go kind of sum it up for you. So Wolff's law also explains degenerative changes after surgery in the opposite lower extremity. It can also explain why you have degeneration in one hip or the other as a result of a shorter leg. So if you can imagine, if your hips are tilted or one leg is longer, you're going to put more weight on one side or the other. So then you can have things like arthritis in your femur because it's being stressed more than the other side. And it's the same concept. I see it a lot. Patients will have hip surgery or knee surgery or ankle surgery on one side, and so they compensate. And what do? You put more weight on the other side. So what does your body intelligently do? It builds the bone stronger and thicker and bigger as a result of that abnormal stress. So it's intelligent of our body to do that, and that's the same concept of exercising. When you exercise and work out, not only do your muscles get bigger, but your bones can actually get bigger. And that's why they say exercise and weightlifting is important, as especially women are in that, in that building stage of the 30s and 40s, because we're actually building bone. All right, so degenerative disc disease on X-ray, it is characterized by, like we talked about, a loss of disc height. So you can see here, pretty much bone on bone. And then you can see here in a milder form that there's just not quite enough room for a healthy disc. The presence of osteophyte formation. So this kind of brings it all together. If you look at the front of the spine here, the front here, especially on this one, you can see that there's extra bone laid down. Those are basically called osteophytes, or you can call it spurring. But the technical term is osteophyte formation. Osteophyte formation is disc degeneration. So you have extra bone being added on here that's not in a normal healthy curve or a normal healthy spine. So to kind of summarize, you have a loss of the curve, so straightening out of the curve, and we already learned that that places up to 10 times the stress of that front of the spine. So you go from normal healthy curve, normal healthy stresses, you go into a straightening or reversal, 10 times the stress through the front of the spine. And then because of Wolff's law, our body intelligently, in response to abnormal stresses, builds bone. What is bone being built in the front of the cervical spine? That's osteophyte formation. Does it all make sense? You're kind of coming together now? I know it's kind of technical. All right. So that is how straightening out of that cervical curve can lead to osteophyte formation in the cervical spine and lumbar spine. So disc herniations, we went over how degenerative disc disease or any sort of osteophyte formation or can that be visualized on X-ray. I can see that your disc space is good or not good looking at an X-ray. To actually see a disc herniation, like to see is this disc healthy or is it bulging, that requires more imaging, like an MRI. So an MRI can show is there actually disc material that's herniating and causing that particular pain. So keep in mind you are more prone to injury or disc herniations with the presence of degeneration. So if you have that loss of disc height and the degeneration, it's no-brainer that you're more prone to disc herniation because that disc is being squished. So degeneration starts with loss of lateral curves. However, if you have symptoms of disc herniation, loss of lateral curve, and presence of degeneration, it's likely you have a bulge or herniated disc. And I feel often MRI is unnecessary to confirm that as long as you're continuing to respond to care. So you can't necessarily see discs on X-ray, but you can kind of speculate what might be going on with that disc on X-ray based on the other signs that we talked about. All right, so disc herniations can occur at any level in the spine. I mean, you have discs all the way from the bottom to the top, all the way from here down. They're more commonly found at C5 and C6 in the cervical spine. Thoracic is not real common to have thoracic herniations, but you can. They're mostly going to be found at T11 through T12, kind of that transition area. And then in the lumbar spine, at L4, L5, and then L5, S1. So if you have a herniation at L4, L5, or L5, S1, that's what's going to be causing your sciatic type pain. Because if the disc herniates here and it presses on one of these nerves, those are the nerves that come together to form the sciatic nerve. So that's most commonly what's going to be causing that radicular pain down the back of your leg. All right. So when cervical discs are herniated, you can have the pain and the tingling and numbness into your arms. Real common to have that if you have any sort of cervical disc herniation. If you have a thoracic disc herniation, it's going to be, sometimes it's just middle back pain, but then also you can have tingling and numbness either into your arms or just across your back. You'll have a little bit of like that nerve type symptom, the same with the sciatic nerve type symptoms. So, studies show that discs lose more hydration in a flexed position. So the longer that you stay in a flexed position, the more your discs are going to lose hydration. Like we talked about, hydration is important for the healthy disc. So this is important for people that work in a flexed position. If they're at work all day losing their disc hydration, that's a good thing for them to get up and walk around and move around as much as they can. So the studies show that flexed position is going to cause the disc to dehydrate faster. Let's see. Sustained, yep, that's the.
So the flexed position is
yep.
Over.
Yep. And if you think about it, say a mechanic or someone in the garden and they're in that flexed position, when you are flexed like that, you're flattening and reversing your lumbar spine. So you're taking this and squishing it this way. And so like we talked about in the cervical spine, you don't want that to be flattened out. So, I mean, sometimes it's unavoidable. If your job is a mechanic, you're going to be in that position. So my advice would be to have a wobble seat or something, or go sit down and do your wobble exercises at work. Just get up and move as often as you can to rehydrate those discs. Let's see. I forgot to mention, there is a 1-to-1 male to female ratio, and it's most common in the 3rd through 5th decades of life. So the study, this was the final line, the sustained loading reduces the fluid content in all regions of the intervertebral disc except for the outermost 2 millimeters. All right. Disc hydration and good health depends on motion. The disc is nourished through a pumping mechanism. Our bodies were designed to be in motion. It reminds me a lot of veins. Our veins in our body, to return blood to the heart, depend on muscle contraction. I don't know if you do that. That's why a lot of times people that are bedbound or can't walk a lot have edema or pooling of blood in their legs because they're not getting that muscle contraction to return the blood to the heart. It's the same concept. The body is dependent on motion in a lot of areas of health, and especially when it comes to the disc. The discs are hydrated by a pumping motion. I'm sure a lot of you have already heard a little bit about this, and that's why we have the cervical traction unit, because that's the mechanism to pump the discs. So, movement-driven pump mechanism alternately compresses and relaxes pressure on disc, pumping water and waste products out and water and nutrients in. So basically, when we move, our discs are being hydrated, but even more importantly, waste products are being removed from our disc, and it's kind of a gradient type system. So in short, movement is required to keep our discs hydrated and healthy. The intervertebral disc is not inactive. It is capable of self-maintenance and injury. It can repair itself and has considerable regenerative properties. So in order to repair itself and heal, you have to have motion in some instances, in most instances, because if you have any kind of disc injury, you're going to have to work with the body to get the waste material out and the good nutrients in, and that's going to be how it heals. The disc is also dependent on the pumping process for healing on a histological level. That means on a tissue level. If there's an injury or herniation, the pumping process brings nutrients in and pushes waste products out, speeding up healing. This is why movement and chiropractic here especially help heal discs. Chiropractic adjustments help reintroduce motion into that segment. So if you have a certain segment of your spine that's not moving like it should, as many wobble exercises you do, if it's stuck, it's stuck. So the chiropractic adjustment helps mobilize that joint and get it moving correctly again, and then you can continue on with your motions to keep pumping and hydrating the disc. Which is unfortunate because herniated discs are very painful, so as much as you know you need to be moving, it's hard because it's painful. You're in a lot of pain, but if you can kind of push through it to tolerance, it'll help it heal. All right, so on to different types of causes of sciatic pain. Piriformis syndrome. The piriformis muscle is this one right here. It goes from your sacrum out to your femur. This is the muscle that externally rotates your hip. So when you do this movement here, that's your piriformis muscle. All right, so you can have sciatic type pain because of an inflamed or aggravated piriformis muscle. Through injury, poor posture, exercise, the piriformis muscle can become inflamed or taut and cause irritation to the sciatic nerve. You can see how close a relationship they have. They run real close together. So if that muscle is too tight or even sometimes too weak, it can cause sciatic type symptoms. So we also have a certain percentage of people that have the sciatic nerve running through the piriformis muscle. I think it was about 15% where you can have the sciatic nerve either splits it and goes part of it this way and the other part under, or it can go completely through it. So definitely in these people, you're going to have some sort of sciatic type pain. Not a whole lot you can do other than try and relax that muscle as much as possible. But yeah, that's definitely going to be a cause of sciatic type pain. Anytime I have a patient with sciatic type symptoms, and especially if their x-rays look pretty good, then I start to move on to other things that might be causing this type pain. I'll have them do piriformis stretching. So if the muscle is taut, it needs to be stretched. And this will sometimes help. And then I'll use the arthrosin directly on the piriformis muscle, and that sometimes will help relax it. That's the kind of thing. But here's the piriformis muscle. If there's a trigger point or it's taut or there's something going on with that muscle, this is the distribution of pain. And that's the exact same distribution of the sciatic type pain. Osteoarthritis. So we already talked a lot about arthritis and how that can contribute to disc pain or nerve pain. But this is a little bit different. Not only does osteoarthritis or degenerative disc disease cause disc herniations, you can also have bony growth pressing directly on the nerve. When an osteophyte grows into the intervertebral foramen, so if you look here, every nerve exits a hole, and the hole here is called the intervertebral foramen. If you have severe degeneration in your spine, you can actually have one of those bony growths growing directly into that foramen and pressing right on that nerve. So that can be another cause of sciatic type pain or nerve type pain. And you can see in the pictures, directly pressing on that spinal nerve. Another cause is called spondylolisthesis. So spondylolisthesis is basically a slipping of the spine forward. So you can have a break here, or you can have some sort of degeneration here, and it causes that lumbar spine, most commonly in the lumbar spine, to kind of slip forward like this. If you have it in the lumbar spine, you can imagine if it's severe enough that's going to cause some nerve impingement, and that's going to cause, if it's in that distribution, it's going to cause that sciatic type pain. And this is visualized on x-ray. So if you have a side view x-ray of your lumbar spine, you can tell if one is looking forward or not. And that can be a cause of that sciatic type pain. It gets bigger and grows. It can press directly on the nerve. Chiropractic care is great for sciatic pain in pregnancy. It helped a lot when I was pregnant. And then you can also do the piriformis stretching and then kinesiotaping. And ultimately, it should get better once you deliver. Chiropractic care is great though because it can help rebalance the pelvis and make sure everything's in alignment there. And then it can definitely release some of that sciatic pain. Sciatic type pain can also be caused by sacroiliac joint dysfunction or subluxation. And I see this a lot. If I take x-rays and you have a good healthy curve, no sign of degeneration, I'm not really sure it's a disc, then I'm going to definitely check the SI joint. So the SI joint is made up of the sacrum and the ilium, and they come together and form a joint. And you can see here on each side. So you take your hands and you put them on your hips. There's kind of, those little indentions on some people, those little dimples. Some people have them, some people don't. That's going to be what's called your posterior inferior iliac spine. That's going to be right over your SI joint. This joint is the one that's in motion as you walk. So if you're walking, you're moving your ilium and your sacrum. You want good motion in these joints. It's important. So I find any kind of inflammation or irritation or subluxation in the sciatic joint can cause that radicular type pain through your glute and sciatic type pain. So what causes sacroiliac joint pain? It's often caused by a hip tilt or restricted joint. So a hip tilt, as you can see, is when you have an x-ray from the front and your hips are sitting like this. These joints are going to have a real hard time functioning properly if your pelvis is sitting tilted. So I'll usually address that first, and chiropractor will adjust based on sciatic or hip tilt. And that helps to relieve that pain of the SI joint, causing that sciatic type pain. You can also have one of them restricted. It has adhesion, it's not moving well, and that can definitely cause that type pain too. So here is another visual. Here's your sacrum here, and your SI joints here. Chiropractic adjustments into the restricted SI joint can reintroduce that proper motion and relieve the pain. All right, so posture. How does posture affect sciatic type pain? It's going to play into the duration and lifelong health of your spine. When you look at normal posture, you want to look at this one here. So from a side view, you want your ear, shoulder, hip, knee, and ankle all lined up. If you're a patient, we take posture images on everybody when you start here because we want to make sure we're working on your posture. We want it to be here, and then a lot of times people are more here, rounded forward, their head is gone this way. It's kind of like, it's called an upper cross syndrome or forehead posture, where your ears have gone forward and your shoulders forward, and detrimental effects. So your ear, shoulder, hip, knee, and ankle should all be lined up from the side view, and this allows for the side view curves of the spine to operate as they should. So if you look here, in this case of forward head posture, there's no way he can have a good C-shaped curve of his spine because his head is too far forward. So you bring the head up, and that allows the C-shaped curve to be there, and you want the top of the cervical spine directly over the bottom, and then it compresses like a spring. But it's crucial to make sure posture is where it should be, because as much as I try to fix that, his spine, I'm not going to be able to fix it until we work on his posture as well. So the further your head goes out in front of you in your shoulders, the heavier your head is going to feel. If you've done posture images with us, we kind of go through that with you. The more forward from your ear to your shoulder, the more forward your head is, the heavier your head's going to feel. And that's just physics. You hold a bowling ball here, it's going to feel 10 pounds. The moment you bring it further and further out, it's going to get heavier and heavier and heavier. And it's the same concept. Also, the further your head goes forward, you can straighten or even reverse your cervical spine. And we just learned the detrimental effects of loss of the cervical curve, so it goes to show how important a healthy posture is. If you look at DMX, so we have the DMX machine, the digital motion x-ray, and you go into forward flexion. So I'm watching the spine, and I'm going into forward flexion. That reverses the cervical spine. So you can imagine the longer that you stay in a flexed position, the worse it's going to be for your spine. Obviously, our bodies were designed to move, but not necessarily stay there. All right. So typical medical treatment. This is just a short list of each thing that we talked about and what you would typically find if you went to a medical doctor and tried to get help for a mechanical problem. So herniated disc, most of the time they'll say bed rest, which we learned already is probably not the best thing. And then if it doesn't improve, you can't get relief. Sometimes they'll go in and do a decompression surgery or what's called a laminectomy. A laminectomy is when they go in, and these are the laminas here on each side of the spine. These are the laminas, and they'll actually saw here and take this out. And that's a laminectomy. That gets the pressure off the disc because you don't have bone there anymore. So for the rest of your life, I mean, you can imagine your spinal cord is here. So if you don't have the sinus here or the lamina, that leaves your spinal cord pretty vulnerable for the rest of your life. I mean, sometimes surgery is necessary, but a lot of times we can help a lot with chiropractic care, different things. Piriformis syndrome might send you to a physical therapist and work on stretching and rehab and things like that. They do injections directly into the muscle. Lumbar osteoarthritis, medication for long term, because osteoarthritis, that's degeneration, so you're pretty much stuck with that the rest of your life, is what they'll say. It's just going to get worse and worse and worse. So most of the time, probably big on medication. Spondylolisthesis, surgery if it's unstable. So spondylolisthesis is where the spine slips off of each other. So like falls off a cliff. And obviously sometimes that needs surgery. You don't want, if you keep going forward, your spinal cord is going to be pressed on and maybe even severed. So if this happens due to trauma, that's a lot of times going to need surgery. Pregnancy, maybe medication. Ultimately, the medical route is you're going to deliver eventually and have this baby, and then the pressure will get off that sciatic nerve. A pelvic lesion or tumor, we can go into this a whole lot, but it's the same concept of a pregnancy. If you have some sort of tumor or lesion in your abdomen and it's pressing on that sciatic nerve, if it's cancerous, one of the treatments will be obviously surgery to remove it. And then sacroiliac joint dysfunction, they will do, I'm sure other things, but they will do an injection right into the SI joint. So they'll take the needle and inject into this joint here and try and relieve that pain. But as we talked about, if the pain is due to a pelvic imbalance or adhesions in that joint, an injection is pretty much a band-aid on the problem that's not going to be fixed with an injection. All right, so either people don't realize chiropractic care won't help. I realize that it's still not quite mainstream like I'd like it to be, or they're hesitant or afraid to get adjusted. I have met a lot of people that are scared of chiropractic. However, when you look at the traditional medical treatments, and the list goes on, this is just kind of an example of what they might do. There's no doubt which I would try first. I would much rather try chiropractic to relieve my sciatic type symptoms or different stretches or things like that rather than going to get injections into an SI joint. To summarize, sciatic pain can be caused by multiple things. Sciatica, like we talked about at the beginning, is a symptom, so you kind of want to investigate what's causing it. As a chiropractor, my exam and x-rays can usually give me a good idea of which is causing your pain. I can kind of narrow it down. If I take x-rays and you have a cervical reversal and your arms are numb, I'm going to kind of guess that even without MRI, that you probably have a disc herniation because of that reversal. You're probably pressing on that disc, which is pressing on that nerve, which is making your arms go numb. Not treat it as such. If there's a loss of vital curves, restoring them is a priority. I also focus on postural correction, scoliosis correction, and balancing the muscles. Okay, so to go into a little bit of prevention. So you maybe don't have disc degeneration, or maybe you don't have sciatic type pain now. These are some measures you can take to prevent them. Regular chiropractic care. We've already talked a lot about that and how that can help. Staying active and moving keeps your discs hydrated. And that's the same concept as the wobble chair and the repetitive cervical traction. That keeps your discs hydrated. Make sure you're working on getting your posture normal and keeping it there. We already noted the importance of good posture and how it relates to your spine. Getting off of big pillows. So you want to talk to your doctor about what kind of pillow is best for you. Ergonomic changes that allow for better posture. If you're at a desk and you have to be at a desk, make sure your computer is at eye level. If you're a mechanic and you have to be bent over a lot, take breaks throughout the day to move. It's important. So if you currently have sciatic type pain, or you have had it in the past, especially the current category, the best thing to do is to get adjusted regularly. A lot of times with patients that have sciatic type pain or nerve type pain, you want to get in at least twice a week initially. Repetitive cervical traction, cervical traction on the wall, wobble feet exercises, stay moving. It hurts, I understand. You want to stay within a tolerance range, but you do want to stay moving. You also want to get plenty of rest. Research shows that laying supine helps to rehydrate the discs. So the body intelligently knows that we need rest. And when you're resting, you're rehydrating your discs. Don't smoke. Research has shown that smoking speeds up the disc desiccation process. And disc desiccation is basically disc dehydration. You don't want dehydrated discs. That is on MRI, that is the first level. That's the first sign that your discs aren't healthy, is they're not hydrated like they should be. Also, supplements that support disc regeneration. So, chondroitin sulfate, collagen, and if you remember when we went over the actual disc and what it's made of collagen and things like this. So if you have a disc herniation and your body's trying to heal it, it helps to put those type of ingredients into your body for your body to use to continue to heal that disc. And ultimately, give it time. We learned that discs are self-healing. You can speed up the process with the things that we talked about, but your body needs time to heal. I learned in school that when you have a disc herniation and it's pressing on the nerve and you have the symptoms and the radiculopathy, it takes a shrinkage of just 25% of that herniation to completely resolve your symptoms. So it doesn't take a lot for those symptoms to kind of subside, but you do want to give it time and definitely give your body the support that it needs. An important note, if you have had sciatic type pain in the past and you didn't really address it, so you've had this type of pain in the past and you just kind of let it run its course and never really addressed why it was there, it's like a ticking time bomb almost. If you never address the cause of that, then it's likely to come back. If you don't address the underlying issues, you will continue to have injury to the discs. You may feel fine at the moment, but most definitely you want to get spinal x-rays to make sure your spine is healthy. and it will continue to be healthy for the long term. Research shows you're much more prone to injury without those healthy lateral curves. And this is mostly for making sure those lateral curves are in place. So definitely want to get that checked. So that's the end of my material. I wanted to mention the next workshop. It's going to be on July 17th. This will be Dr. Mike's workshop. It's titled Bulging Bellies, What Clogs Your Pipes and Makes You Fat. That will be interesting.
Yes.